Hi, I'm Dr. Barbara Gannon, and you're about to watch a short video about your baby from the doctors here at Washingtonville Pediatrics. Let's start with a look at how your 1-month-old is developing from our friends at Simply Parenting.
In the beginning, newborn babies do not appear to be very active. They sleep, wake up to feed, and sometimes cry and fuss. But in a matter of weeks, you'll begin to see a unique little person emerge. Your baby will begin to take in and react to a world of sights, sounds, and especially people.
Daddy's hair, definitely.
Newborns can clearly see an object that is 8 to 10 inches from their eyes. Conveniently, this is pretty much the distance between a baby and a mother or father's face during feeding. After about 6 weeks, your baby will begin to imitate your facial expressions and may even attempt to smile. At about 8 weeks, smiling will occur more naturally. This is proof that your child's social education is well underway, and more importantly, it's time to break out the camera. You may notice that your newborn always rests in symmetrical positions. Arms and legs are often in the same pose on both sides of the body. This is a normal stage of brain development. Since the muscles in your infant's neck won't reach their full strength until 3 to 4 months of age, your baby's head will be wobbly when he or she is pulled upright. Although newborns don't have much control over their muscles, they do have some reflexes that you should be aware of. If they hear a loud noise or fall suddenly downward, they will move their arms out and then in, and they may grimace or cry. This startle reflex is normal. You may have also noticed that your newborn's hands are formed into a tight little fist. The fingers will loosen up, but for now the reflex is to grab on tight to your finger. Toes will react to your finger too. It's the simple connections that count at this age. And you'll need these playful, loving times to get through the inevitable fussy periods. Most babies will have bouts of crying or discomfort once a day. Sometimes babies can soothe themselves by sucking on a hand or a finger, but you may want to try holding, rocking, or giving your baby a pacifier. Don't be afraid of the pacifier. It's not harmful to your baby's development, and using one now does not mean your baby will be dependent on one in later months. In general, you'll find that the frustrating moments of raising a newborn are far outweighed by the rewarding ones. Enjoy this time when your baby is so tiny.
The most common question we hear is how often you should feed your baby, and there is no one answer to this question. Our staff will help you with this, but here are some guidelines. If your baby is nursing, feedings should be about every 2 to 3 hours, depending on how satisfied the baby is. And that allows for some 4-hour periods where the baby can go longer or is sleeping well. For formula, you can use the rough estimate of 1 hour for every ounce taken. So, if your baby has consumed 3 ounces of formula, theoretically, they should be able to wait another 3 hours until the next feeding. If you are breastfeeding, you can introduce a bottle at this time. If you're going back to work before your next visit, please discuss pumping and proper storage of breast milk with our staff. And remember, no solid feedings yet, no honey, which can lead to infant botulism, and no medications other than polyvisol vitamins for breastfed babies. Stooling for a newborn can vary in frequency from 1 time a day to several times a day, and the consistency can vary from runny to mushy, but should not be as thick as peanut butter at this age. For breastfed babies, stooling can become less frequent, even once every 3 to 4 days. As long as your baby is feeding well and does not appear to be uncomfortable, whatever pattern emerges will be normal for your baby. However, if your baby is having a difficult time passing hard stools, or if your formula-fed baby does not have a stool for over 48 hours, please call our office. And remember that several wet diapers a day is a good sign of adequate feeding. So if your baby does not have a wet diaper in an 8-hour period, you need to contact the office. Continue to have your baby sleep on his or her back to reduce the risk of sudden infant death syndrome. Try to put your baby in the crib sleepy, but not asleep. It's okay to let your baby fuss for a while and even cry for short periods of time before settling down. This is a good way for babies to learn how to soothe themselves to sleep. Your baby should be sleeping in his own space, but not in your bed to reduce the risk of injury or suffocation. Now, let's review some safety tips.
Follow these tips to keep your baby safe and sound. To prevent falls, make sure your baby is strapped securely into all infant seats. The safest place for these seats is on the floor. In addition, never leave a baby unattended on a changing table, even if you've never seen your baby roll over. All babies must ride in a car seat, and that seat should face the rear of the car until your child weighs 20 pounds and is 12 months old. To prevent injury from airbags, car seats should always be placed in the back seat. Bottom line, be strict about safety. Your baby depends on you.
Hi, my name is Debbie, and I'm one of the nurses here at Washingtonville Pediatrics. Here are some reasons to call our office. If your baby has a fever rectally with a temperature of 100.5 or greater, if your baby is refusing to feed, or if your baby is unusually fussy or irritable, if your baby is vomiting with more force than just spitting up, or any time you are worried about your new baby. Please feel free to call our office. We're here to help in any way that we can.
So let's end by having a look at having fun with your new baby.
One of the most stimulating activities for newborns is also one of the easiest, making faces. Babies react very intensely to the human face, so be broad, be silly, be dramatic, but most importantly, don't be shy. Newborns can focus clearly only up to 8 to 10 inches, so get up in there and smile. As your baby's eyesight develops, he or she will be attracted to bright lights, bold shapes, and sharply contrasting colors, including black and white designs. Newborns also love moving objects, so consider placing a mobile above the crib. As far as hearing goes, there is something to be said for that soft, high-pitched voice many of us instinctively use when talking to babies. They respond strongly to it. Touching and holding are also great ways to communicate with your newborn, and no doubt you'll enjoy this togetherness too. There's nothing like a warm cuddle to help calm a fussy baby. In fact, studies show that responding promptly to your baby's cries will actually reduce the amount of crying within the first 3 months. Babies also appreciate a change of scenery, so don't be afraid to take your newborn out for a stroll. Don't worry about the weather unless it's extreme or you see a storm brewing. Just dress your baby as you would yourself and add a hat to protect him or her from the sun. A trip to the park is also a great way to meet other new parents.
Thanks for watching. We'll see you next month when your baby is 2 months old.